Good morning, everyone. Myself Sunita. Welcome back to another session of Cancer Care at American Oncology Institute. And today we have with us Dr. Sugna Joga, consultant medical oncologist. She has done her post-graduation DNB in general medicine at Care Hospital, Hyderabad. She subsequently pursued super specialty course in medical oncology at the prestigious Rajiv Gandhi Cancer Institute and Research Center in Delhi. She is the author of many publications in reputed national and international journals. She has a keen interest in research and was an investigator in various breast, ovary, colorectal, and lung cancer clinical trials. And today we have Dr. Sujana Joga to discuss about advanced immunotherapy treatment. Welcome you, ma'am, on behalf of AOI Mangalagiri. What is meant by immunotherapy, ma'am?
Immunotherapy is a type of cancer treatment where we use our own body's immune system to fight against the cancer cells. What is immune system? It consists of cells, organs, and tissues in our body, our own cells. So it constitutes the skin. In the blood, we have the white blood cells and the lymphatic organs, which constitute the spleen, thymus, and the various lymph nodes. These all constitute the immune system, which fight against any foreign body which enters inside.
Lot of people are having confusion regarding chemotherapy and immunotherapy. How is it different from chemotherapy, ma'am?
So chemotherapy is the traditional way of treating cancer where the drugs are derived from the laboratory predominantly, and these are synthetic compounds which are artificial compounds, and they act both on the normal cells as well as on the cancer cells. So they have a lot of toxicity. So the side effects like hair fall, fertility issues, and the blood counts going down all happen because of the non-specific nature and the diffuse mechanism of action of this chemotherapy. In contrast, the immunotherapy acts specifically on the cancer cells only, and the normal cells are not affected. Hence, the toxicities are minimal. And the other added advantage is that these are biological substances which are naturally occurring and derived from the living organisms with very minimal side effects.
In cancer, what happens to the immune system now?
So, the nature has just, designed our body such that whenever a foreign body enters inside, we can fight it with the help of a strong immune system. So, the immune system, if it gets overactivated also, we have some problems. To prevent that, there are some checkpoints. So the cancer is so clever that it inhibits all these checkpoints and proliferates at a very rapid rate. So cancer evades our immune system by expressing some different proteins so that they are not recognized. Our immune cells will not be able to recognize them, and hence it goes on proliferating. That is where the immunotherapy works. We target those proteins and inhibit them, and so that the cancer cells can be easily recognized by the immune cells and destroy them.
How does the immune system treat cancer, ma'am?
So there are a couple of ways, as I have told earlier. One is boosting up the immune system to recognize the cancer cells, and the second is artificially introducing some proteins or antibodies into the body which directly go to the cancer cells and destroy them.
What are the types of immunotherapy, ma'am?
So there are 5 different types of immunotherapy. First is the immune checkpoint inhibitors. Second is the cancer vaccines. Third is the monoclonal antibodies. Fourth is the immunomodulatory drugs. Fifth is the T-cell transfer therapy.
So many are there. Can you please explain about each type, ma'am?
Yes, to make it simple, coming to the immune checkpoint inhibitors, as I have discussed earlier, so there are some checkpoints to prevent overactivation of the immune system. So cancer switches off that speed breaker system and evades that immune system recognition. So we send some proteins or some antibodies inside so that these proteins are knocked out and the immune system gets activated. This is the immune checkpoint inhibitor. Next is the monoclonal antibodies. These antibodies are synthesized in the living organisms and infused into the body so that these substances go directly to the cancer cells and destroy them. The third type is the T-cell transfer therapy. Here, the from the patient's blood, we take out the T lymphocytes, separate them, and grow in the laboratory along with the small amount of protein which the cancer cells express, so that the T cells can recognize these cancer cells. So once again, these primed T cells are sent back into the patient. Okay. Whenever these primed T cells go inside, they directly go to the cancer cells. They find and destroy the cancer cells. So that is one type of treatment. And the next one is the cancer vaccines. We have both prevention and treatment related cancer vaccines. The prevention vaccines, as we know, the human papilloma virus related vaccine, which is prevents the cervical cancer related to HPV, and the hepatitis B vaccine against the hepatocellular carcinoma caused by the hepatitis B. So the concept behind the cancer vaccines is that a small amount of protein is introduced into the human body, and in a very small amount, and so that the body recognizes it and releases some small amount of antibodies. So whenever the patient is getting cancer in future, so there will be large amount of antibodies being released. So with that concept, the cancer vaccines, treatment vaccines, as well as prevention vaccines have come into play. Next, the last one is the immunomodulator therapy. Here, the cancer cell is not a single entity. Around the surrounding it is the supporting cells called the stromal cells. These cells also support the growth of the cancer. So when these immunomodulatory drugs disrupt this tumor microenvironment or surrounding environment, and hence the cancer growth is stopped.
Which cancers are treated with immunotherapy, ma'am?
Immunotherapy can be used in the treatment of many varieties of solid cancers as well as the hematological cancers like leukemias and lymphomas. And the solid cancers, the lung cancer, melanoma, breast cancer, and bladder cancer are most likely to respond to immunotherapies. And in the rest of the cases, there is a minimal response to immunotherapy. So I would like to mention one point that immunotherapy works by stopping the growth of the cancer cell. It doesn't cure the cancer. This has to be remembered.
How is it given, ma'am?
It is usually given by intravenous route, and the duration may vary from daily to weekly to monthly to monthly. It all depends upon the type of cancer you are using and the type of immunotherapy drug you are using. And it can be given in combination with chemotherapy or immunotherapy alone, or it can be given after surgery or after completion of radiation. So there are many indications, and it all depends on the type of drug and the type of cancer in which we are using.
Okay. Can it be given to all stages of cancer?
So previously, the immunotherapy drug concept just involved in the late 2005 to 2010, very active research was done. Ultimately, in 2010, the immunotherapy drug was approved in the melanoma stage 4 cancer. Later on, the trials extended on to the earlier stages, stage 3, 2, and as early as 1 trial are going on. As of now, stage 4 is the standard of care in patients who have not responded to chemotherapy in the second. We can use immunotherapy as a second line.
Okay.
Even at stage 3 and stage 2 also we are using.
What are the side effects of this immunotherapy, ma'am?
So immunotherapy, because it uses our own body's immune system, we are not introducing anything artificial into the body, so the side effects are very minimal.
Okay.
So the normal side effect, like with any drug administration, like the allergic reaction or fever, the chills, and hypersensitivity reactions can happen. Along with because it is activating the immune system, sometimes it acts not only on the cancer cells. It might activate the normal cells also, so that that immune inflammation syndrome can be seen in the other organs also.
Thank you, ma'am. Thank you for clear information regarding advanced immunotherapy treatment. Thank you all for watching this live session. Stay tuned and please subscribe to our channels. If you have any questions or queries, please reach to us through a messenger or post them in the comment section. Thank you.